Yeah.
Let me switch the slide.
Okay.
All right, so I'll start both sections with myths that hopefully will debunk by the end of the talk. So I'm gonna look here because it's backwards for me, but so this is nutrition myths about kids that are mostly vegan or mostly plant-based. I'm sure if you have kids that are vegan or plant-based or even vegetarian, you might hear this from relatives or friends. And I know, so I have two children and both of them are vegan, and I've definitely heard this various versions of this for them. So a lot of people say vegan kids are shorter than their same age group kids in class. They have brittle bones, they're weak, they get sick all the time, they're anemic, they have low iron, they have vitamin deficiencies, they have protein deficiency. And also, this is more, I think, in the US, which is where I used to practice. I actually still practice too. Some doctors even have said that feeding your child a plant-based diet is a form of child abuse, which is very extreme and horrible. I, of course, don't agree with that, but just wanted to throw that out there. So my training in the US and still practicing there, the American Academy of Pediatrics is like my governing body, I guess. So this is a quote from them that came out 2-3 years ago. They made a statement saying that well-planned vegetarian and vegan eating patterns are healthy for infants and toddlers. So this was a really big deal in the medical community. And we'll kind of explore that through the ages. So as I just mentioned, from in utero, from when a mom is still pregnant with a baby until they're 18 and going off to college. Not only is it safe, but it's actually healthier than a omnivorous diet. So starting off with pregnancy, this is safe. And I was just telling everyone here just now, so I have two kids. My second one, I was actually vegan when I was pregnant with him for half the pregnancy. The first half, this is due to a documentary that I watched. And I decided from that day that so I was vegetarian already, but I decided to become vegan about halfway through, I think. And I still had a very healthy pregnancy, and you'll see at the end, I have a picture of my two kids. They're both very healthy and still just as crazy as non-vegan kids. So anyway, just in general, this doesn't apply to only women that are plant-based. Pregnant women require more calories, of course, because they have a growing baby inside them, more protein, more folic acid. That's for everyone. So it's really important for a pregnant woman, especially that is plant-based, a very varied diet. So you can't just be eating meat substitutes and soy milk. You have to eat the rainbow. You have to have vegetables. You have to have beans, legumes, nuts, seeds. And studies have shown time and time again, if you eat a good varied plant-based diet, you'll meet every nutritional requirement except for two, and I'll get to that of the slide. Sorry. There's also a study that came out a couple of years ago saying that low fiber diets are associated with developmental delays later on. So kids that have learning difficulties in school, and even motor and sensory delays when they're babies. So they might not walk very on time. They might have trouble with fine motor skills. They might have trouble with social interactions. And the good thing about a plant-based diet is it inherently has a really high fiber content because you're just eating more vegetables, you're hopefully eating more beans and greens and seeds, etc. So if you have a vegetarian, especially a plant-based diet, you will definitely have more fiber. Better for your baby. There's also, so ALAs are a type of fat that's really important for the baby's developing brain. A lot of prenatal vitamins have ALAs or DHA in them, and that makes them non-vegetarian or non-vegan. But you can get these from a plant-based diet, especially from nuts and seeds. So you don't even have to take the supplement. There's also multiple studies have shown that being pregnant, and if you follow a plant-based diet, especially a mostly plant-based diet, there's a lower risk of developing gestational diabetes. Gestational diabetes has many risk factors for the mom and for the baby. The baby can be too big, can have something called shoulder dystocia, which can cause dislocation of their shoulder when they're coming out of the mom. They can have low blood sugar when they're born. They have higher risk of diabetes themselves later on. And then for the mom, just having a very large baby is dangerous for her too, lots of bleeding, et cetera. So if you follow a plant-based diet, there's a much lower risk of gestational diabetes throughout the pregnancy. And then finally, I mentioned earlier, you can get every nutrient you need from a plant-based diet for pregnancy. And this actually applies to kids, which I'll talk about later, and even adults. It's very important to take more folic acid when you're pregnant, 400 to 800 micrograms per day, which is basically what a prenatal vitamin should contain. So that's just for pregnancy, but vitamin B12, which I'll talk about a lot today, probably 95% of people, vegetarians, vegans, non-vegans, don't get enough B12. That's because vitamin B12 is found in bacteria, which is found in the soil. And back in the day, before we were all so clean, we would get B12 because we'd be eating a little bit of soil, a little bit of bacteria, but now everything's cleaner, which is good for the most part, but we don't all get our B12. So when we in our clinic do blood tests on people that are even, they eat a lot of meat or eat a lot of dairy, they still have a low B12. So I think that's a fairly urban legend that you have to have dairy and meat to have B12. That's not really true. Most of our patients, ourselves included, take a B12 supplement. Now you can switch. All right, so I talked about the B12 just now, folic acid. I usually tell pregnant women to err on the higher side of folic acid. The problem with folic acid deficiency in pregnancy is it can cause something called neural tube defects, something called spina bifida, which basically means the baby's spinal cord gets tethered so they can't use their legs and they can be paralyzed. So I've taken care of kids with that, and it's obviously very devastating, but very, very easy to prevent. Vitamin D, so that's another one that I'll talk about a lot of today. Pregnant women require a higher amount of vitamin D during pregnancy. Most people require about 1,000 to 2,000 units, adults, I mean, just for their daily intake, but pregnant women about 4,000, so about double. Iodine is starred because you can just get that from your usual table salt. Make sure it's iodized salt. And then omega-3 fatty acids. Don't have to eat fish for that. You can get that from nuts and seeds and even from some legumes. So everything, as you can see, could be from a plant-based diet. All right, so let's move on to once the baby's born. Multiple studies have shown that breast milk of vegan moms is equivalent to breast milk of non-vegan, of vegetarian, of omnivorous moms. They've actually taken the breast milk and analyzed it and done mass spectrometry and looked at everything, every little nutrient, and it's basically equivalent. That is making sure, again, that the mom is having a good varied diet with plenty of fruits, vegetables, legumes, lots of water. And the carnitine is another one that's very essential for babies' brain development. But again, you can get that all from the plant-based diet. Vitamin D, as I mentioned, continues to be important. So if a mom is breastfeeding, she actually needs even more vitamin D. So I mentioned 4,000 while pregnant, it's actually 6,000, close to 7,000 while she's breastfeeding, and then the baby will get enough through the breast milk. The alternative is to give the baby vitamin D drops, and that's about 400 international units per day. So you can do it either way. Calcium, iron, iodine, B12, these are all found in breast milk. Again, B12 with the caveat that mom should be taking a B12 supplement. And then I did a talk at another doctor meeting a couple of weeks ago, and there was a big discussion about soy formula. So from my understanding, soy formula not available here in India.
No, it's
It is available. Okay, good. So yeah, so Vihan, my 6-year-old, he's sitting in the audience you can't see him here. So I breastfed him until about 7 months, and then I had to start supplementing, and I chose to give him soy formula. He never even got cow's milk formula, and he is fine and jumping all over the place. So it is totally fine and totally safe, even if you can't breastfeed your baby at all for a medical reason. In pediatrics, we say fed is best. So please don't beat yourself up if you can't breastfeed your baby. I am a completely formula fed baby. My mom couldn't breastfeed me at all. I also think in the time that I was born, maybe they didn't help her enough, but that's a whole other story. So I got soy formula my entire infancy. And I don't know if that has something to do with the fact that, so I'm vegan now, but I've only been vegan since I was pregnant with my son, so about 7 years. I have always hated the taste of milk, of cow's milk. So that part wasn't difficult for me. So I don't know if that's maybe because I grew up with soy formula. Anyway, I digress. Okay, so late infancy, meaning 6 months and later. We recommend for all babies starting solids around 6 months. And we recommend a nice varied diet for them. So don't just start with fruits. That, of course, that's fine, but we want you to introduce mashed up legumes. We want you to introduce possible allergens early as 6 months. So meaning like nut butters, nut powders, berries are a big allergen, melons, sesame, all of these. It is perfectly fine and encouraged to start them as early as possible. Israel is a good example of a country where they introduce allergens very early, and there's an extremely low incidence of food allergies there. So he started getting peanut powder. I used to mix it with his fruit around 6, 7 months also. And no allergies for him, thankfully. So best is to continue breast milk or formula, like I mentioned, preferably soy formula. Formula would be fortified with vitamin D and B12. So you don't necessarily have to take a supplement, but if you're breastfeeding, then either you or baby should be taking the supplement. Baby-led weaning is another newish thing that's been going on. So letting the baby feed themselves, of course, they have to be very carefully monitored, make sure they don't choke, but baby-led weaning has been shown to, baby is less picky, is a lot more interested in a variety of foods. So it's very, very beneficial, but of course they have to be watched carefully. And just start them early with a big variety of foods, and studies show that later on they're less picky and they eat a better diet. So moving on to toddler and preschool age. So from 1.5 years to 3, 4 years. So as all of you guys probably know, they're small and picky, but they actually have different and big nutritional needs compared to older kids and compared to adults. I'm going to show a chart in the next slide, but they need a lot of fat. So it sounds counterintuitive to what every doctor tells you, but they need a lot of fat, of course, good, healthy fats, plant-based fats, from nuts, from seeds, from good oils like avocado oil, olive oil, that sort of thing, sesame oil. So they need a lot more fat comparatively to their size. It helps their brain develop. It helps their joints develop. And a high carb diet, because as again, you guys know, they're running everywhere. They're using up a lot of energy. So they need lots of carbs, good carbs, healthy carbs to support them. Snacks. So certainly toddlers don't need to stick to 3 meals a day. We encourage snacking because, again, they're always moving. Make sure they're healthy snacks, little bite-sized things they can feed themselves. Water or milk, I put MYLK because I want it to be plant-based milk if possible. Another thing to say is once they're over a year old, they do not need any milk. If you don't want to give them soy milk or almond milk or coconut milk, that's fine. They just need water. They're going to get all their nutrients from everything else that they're eating. But if you want to give them something, if they feel left out from their friends that are having cow or buffalo milk, then of what's available in India, I recommend soy milk. Soy milk is the closest to cow's milk in terms of protein and calcium and that sort of thing, without the cholesterol, without all the extra hormones and antibiotics that are in cow's milk. So my kids in the morning have a glass of soy milk. And then calcium, you do not need to get from milk or cheese or dairy. In fact, the calcium that comes from dairy is very acidic. So this is more for adults, but over time, because the calcium that you're intaking from dairy is so acidic, your body pulls calcium, which are positive ions, out of your bones to make your bones brittle, to neutralize the acid that's in your blood from eating so much acidity from the dairy. So over time, years and years, it's actually dangerous to have too much dairy. Iron, of course, comes from good leafy green vegetables, from even some fruits. I think papaya has a fair amount of iron in it. Of course, beans and legumes have a ton of iron. And then vitamin D. So vitamin D you'll find some vitamin D in fortified plant-based milks, but of course you'll also find it in similar, like in some, I think mushrooms have a lot of vitamin D, and then the green vegetables also, but most people, kids included, will need a vitamin D supplement. I also believe, I don't know if this is proven, that people of Indian origin have a tougher time absorbing vitamin D. So again, at our clinic, when we test people, we find that probably 95% of them, if not more, are vitamin D deficient, kids and adults. So I can always recommend like vegan vitamin D supplements. There's good ones for kids also. For kids, generally 400 to 600 units of vitamin D is safe. And then B12, everyone needs vitamin B12. For kids, there's some good companies here that make vitamin B12 supplements. The one we use is like a melt away film that you put on the tongue. We used to give gummies to our kids, but then our dentist yelled at us. So gummies are not great. They get stuck in the teeth and cause cavities. So I would lean more towards like a powder, like a melt away film for the B12. All right. So I was mentioning about the increased fat and carb intake. So an average adult needs about 40 to 60 grams of fat per day. This is an average adult. And look at this. These are 3 and 4-year-olds who need 50 grams of fat a day. So that's, to me, this was actually, I didn't realize it was so much. This was a surprising chart. So don't feel bad about giving your kids good oils, good, nuts and seeds that have a lot of fat in them, as long as it's not saturated fat. Saturated fat is found in meat. Saturated fat is found in dairy. But plant-based food does not have saturated fat, except for coconut. Yeah, I knew you were going to look at me. Coconut oil is very controversial. I'm a big fan of coconut oil. And there are studies that show coconut oil is beneficial, but there are some studies that show too much is not beneficial. My husband, my partner here, is anti-coconut oil, but he's also South Indian, so I don't understand why you're anti-coconut oil. Anyway, I myself eat a lot of coconut oil, and my cholesterol is excellent, knock on wood. So for my N of 1 and the kids too, it's fine. But maybe be cautious. If you have to choose an oil, go for avocado oil, peanut oil, sesame oil, olive oil. Of course, avoid palm oil for the fats and also just the environmental impact. So that's the fat part. And then carbohydrates, of course, try to go for non-processed carbohydrates, try to avoid maida as much as possible. So atta is great, the whole grain atta, whole grain breads. There's a lot of great pastas now that are available that are made from lentils. So we give that to our kids. So that's also giving them some fiber and protein as well. And then the protein is not a huge amount. That's why I wanted to note that as well. So in general, humans don't need as much protein as we are taught. It's not 1 gram per kilogram necessarily. I will say, though, if it's a child that's in a big competitive sport, yes, they will need more protein. And that would be something just to discuss with your pediatrician, but they do not need to be overloaded with protein, especially please avoid whey protein. If your kid is an older kid, again, that needs more protein, there's plenty of good substitutes out there. There's pea protein is probably the best one available here. And that's easy to digest. And of course, has none of the bad characteristics of dairy. That whey is basically concentrated dairy, so concentrated saturated fats. And it has all of the bad qualities of dairy, causing acidity in the blood, weak bones, et cetera, over time. But if you get a good plant-based protein powder, that's much safer. But again, if you're going to do a protein powder, please talk to your pediatrician, because that's something that should be discussed with them. You change it?
Yeah.
Okay, so school age up to about middle school. So multiple studies have shown children that have a mostly plant-based diet or a fully plant-based diet have a huge reduction in the risk for lifestyle disease. What do I mean by lifestyle disease? Diabetes, high cholesterol, even hypothyroidism, high blood pressure, obesity. If they're mostly plant-based, the risk goes much more down. There's even a reduced risk for autoimmune disease, such as type 1 diabetes, eczema, asthma. arthritis, like juvenile arthritis, Crohn's disease, inflammatory bowel disease. I could just go on the list, but if you have a plant-based diet, even if the children already, so we've had kids that already have asthma, that already have eczema, that already have acne, when they're older. And we just make the simple, they're already vegetarian. We just take away the dairy gradually and their symptoms significantly improve. We can take them off their medicine. So it's definitely proven. And I'll just beat this into the ground. There's no need for dairy milk, please. You really don't need to do it. You can get everything that you would get from dairy milk from plants. So plant-based calcium, like I mentioned, the leafy green vegetables, especially the cruciferous vegetables like cabbage, broccoli, maybe is also actually a really good source of calcium. Also, these kiddos have very good immunity too. So basically, animal proteins are pro-inflammatory. So if your body is always in a state of inflammation, so there's always white blood cells and inflammatory cells floating around. So if they're already there and activated all the time, if you're exposed to a virus or a bacteria, some kind of communicable disease, there aren't enough of your first line of defense to attack. Good. Sorry, everyone. Okay, great. So I'm not sure where I got cut off, but basically I was saying if your body's always, this is including children, if you're always in a state of kind of minor inflammation and all your blood cells and your first line of defense cells are already being used up because of the inflammatory state, there isn't enough first line of defense to prevent you from getting sick. So generally kiddos that are plant-based are sick for a less number of times and for a less number of days. They just seem to recover faster. And I keep using my kid as an example, but generally he, knock on wood, if he gets sick from whatever's going around in school, it lasts for a day and then he's fine. I haven't had to put him on antibiotics since he was 1. So knock on wood, he had 1 ear infection and other than that, he's been fine. So hopefully it stays that way. Now I've jinxed you, but soy foods, my favorite. I love soy. They're still safe. I don't think I've talked about soy. Yeah, this is a big source of controversy in people that are like, I guess the dairy industry is always bashing soy. There is no evidence at all that soy causes cancer, especially breast cancer. In fact, it actually prevents breast cancer. Multiple studies have shown this. It also prevents prostate cancer, ovarian cancer, pancreatic cancer. Those are the main ones, I think. I always use the example of looking at Eastern Asia, like China, Japan, that area. They eat a ton of soy. They eat edamame, they eat soy sauce, they have tofu in everything. If soy was such a horrible, food item, there'd be cancer, all the men would look like women, et cetera. There'd be this, but they actually have one of the lowest rates of breast cancer in the world in that part of the world. And all the men you've seen them, they're very thin. Most of them, I haven't seen any gynecomastia, which is when men have breasts. So don't worry about giving your male children soy. Again, mine have been getting it every day. So they get soy milk in the morning. We have tofu. Do you like tofu, Vihu? Yeah. We have tofu pretty much every day. They love edamame. Not every day. I should make it more, I guess. They love edamame. They love soy sauce. So yeah, soy is very safe. In fact, it's protective. So please don't worry about giving soy to your children. In fact, the soy hormones, the plant-based isoflavones, which act like estrogen and progesterone and all of the female hormones, they're not only are they protective, but also they can help. So later on, when women are perimenopausal and menopausal, taking soy, preferably natural soy, actually can help with menopause symptoms. And also, it helps girls and younger girls and teens that have a predilection for PCOS. It helps balance out their hormones too. So more soy is better. What I've highlighted in green is basically if you are plant-based, if your children are plant-based, you inherently will have more greens, more legumes, more nuts, seeds, fruits, and vegetables. You have a more varied diet. So you're going to have little to no saturated fat and much less sugar. You're getting everything from a natural source. And this is, of course, assuming that the plant-based diet is a whole food plant-based diet, which I don't think I've even mentioned. That is the ideal diet. So plant-based and vegan can still be unhealthy if you're having Oreos and, and fried food, exactly. So please try to make it. I realize with children, our house is certainly not perfect. It's not, you can't be perfect, but try to gear more towards less processed things, and just overall your health will be better. And unfortunately, we are seeing studies over the last decade or so that plaque buildup, meaning that sticky fat that attaches to the coronary arteries and later on leads to high blood pressure and heart attacks and strokes, it actually begins in school-age children. And this is, of course, some of it's genetic, but probably 75% of this is due to our poor diet. We call, again, I train in the US, so I'm allowed to say this. We call the American diet, which is unfortunately, I think, what is making the rest of the world eat poorly. It's called the SAD diet. The standard American diet is the SAD diet. So try to avoid the SAD diet if you can. Okay, so moving on to preteens and young adults. Again, reduced risk of lifestyle diseases. Diabetes starts showing up. I think the youngest I've diagnosed was age 10, type 2 diabetes, but sorry, that's not true. That was me personally. I took care of a 15-month-old with type 2 diabetes when I was training, and that was 15 years ago. So unfortunately, we see it in toddlers sometimes, and that's mostly a lifestyle disease, unfortunately. So better physical health, meaning a better diet and hopefully better exercise. Very important for this age group for mental health and self-esteem. So whole food plant-based kids generally have less incidence of depression and anxiety. Actually, I read an article yesterday or the day before that kids that grow up having more soy, but also just a more plant-based diet have less ADHD. And there's a big study, like thousands of children, they looked at them. And there's a much lower incidence of ADHD, which is, again, a big thing that we're seeing diagnosed more and more. So it even helps with that aspect. So they do better in school, they're happier, they get along better with their peers. I mentioned about PCOS. Acne is also a huge, basically a hormonal imbalance in your body. So if you have less animal proteins that sit in your fat stores in your body and produce cholesterol, but also produce hormones, hormones are made based on a cholesterol kind of skeleton. So just think about that. If you have more fat sitting around, then you can have more of these extra hormones, more testosterone, more estrogen, which your body doesn't need. Your body needs a good balance. So if you have more of these sex hormones sitting around, you get acne, you get PCOS, you get aggressive children, you get problems with the law later on. So overall, just aim for less dairy, and of course, meat also contributes too. But in my opinion, I prefer whole food plant-based. If I get a child or an adult that is completely omnivorous, they're having dairy and meat, the first thing I tell them to do is to reduce or stop dairy. I think dairy is more harmful over time than meat. Of course, I would prefer no meat also, but if you have to pick one, I would pick dairy. I mentioned briefly about athletes as well. So, we don't need as much protein as we think we do, but of course, competitive athletes do need more protein. So that's something to talk about based on an individual basis with your pediatrician, and keep everything varied. And at this age, I don't think I mentioned it, they will still need a vitamin D and B12 supplement. Okay, so just getting to the end of the nutrition part, just want you to remember a couple of things. It's important to stick to a well-planned and varied diet for children. Planning is easiest, I think, when you're when you're doing a specialized diet like this, a lifestyle of whole food plant-based. So what I do at home is I have on the refrigerator, I have a month, like it's a erasable, a whiteboard. So I plan out the week of what I'm going to cook for dinner and for lunch, for school lunch. And it's just easier than you know what you have to get from the grocery store. The kids can see what they're going to have for dinner that day. But planning definitely helps stick to it instead of, saying, okay, we'll just order out tonight or we'll go out tonight, because generally home cooked food is better. And it's just want to say it for the 80th time. It is preferred, it is safe from pregnancy through age 18 and of course in adulthood too. Vegan children are not shorter or weaker. In fact, they're usually healthier. And I want to mention this too. So I've done blood tests, just routine blood tests on vegan kids, including my own. And other than low-ish B12, everything was normal. No low iron, no anemia, normal cholesterol, normal electrolytes, everything looked fine. And the only thing he takes is a D and a B12 supplement. And I will say the D, we don't always remember, but the B12 he's pretty good about taking. Right? You like your little film? Yeah. And just in general, I will not pretend to say that it's easy to give your kids and yourself a whole food plant-based diet, but it's definitely worth it in the end. And something else I should have mentioned earlier too, for kids and even for adults, yes, it's something that you need to get used to in terms of the taste, but taste buds recycle themselves every 21 to 28 days. So you will get used to the different tastes, like different, for example, soy milk versus regular milk, tofu versus paneer, vegan yogurt versus regular yogurt. It's a vegan chicken nugget versus a real chicken nugget. You will get used to it over time. So keep giving a little bit to your kids. Don't give up. Eventually, they will get used to it. Same for yourselves. All right, so moving on to screen time, as we've all been staring at the screen for the last, I don't know how long, but just wanted to start this with some myths too. So it's not true. I'll go through this why, but lots of people say, well, it's fine because my kids are looking at educational apps and they're watching educational shows. So no problem, they can do screen time. Screen time is completely harmless as long as it's not too much. So even just a little bit is totally fine. But I want to use screen time to calm my screaming toddler down, or I just let them watch something before they go to sleep or when they come home from school. That's okay. They need screens to keep up with technology, especially in school. To some extent, that is true, but not 100%, and I'll get to that. And this is important for infants. If you have the TV on all the time, no worries, it's okay, because they're not paying attention anyway. And then finally, the last one is, as long as they're sitting quietly, it's not harming them. All right, so the recommended screen time, this is the American Academy of Pediatrics recommendations, and the Indian Academy of Pediatrics is very similar. So because I found a graphic for it, I just put the AAP, but they're both very similar. I think the only difference is the Indian Academy of Pediatrics says avoid screens up to age 2 completely, and the American Academy says avoid up to 18 months. I would tend to err more on the Indian side and say if you can avoid it totally until age 2, that's best. But I understand we're all parents, so sometimes 100% compliance not easy. So 0 up until 18 to 24 months. They say limited, they don't necessarily give a number of minutes or hours, but definitely less than 1 hour. I would say less than 15 minutes, and it should be with your child. So if they're watching, I don't know, Sesame Street or something, what was that thing that Daniel Tiger, some Choo Choo TV? Anyway, if you want to watch 5 to 10 minutes of some educational show or like a music thing with your children, then that's fine, but it should be very limited. I do want to say in the 0 to 2-year-old, if it is FaceTiming with a relative, that's okay, because that's considered social interaction in this day and age. So that's okay, but obviously don't make it super prolonged. They don't have that attention span anyway, but that's okay. We don't say you have to avoid that screen. 2 to 5 years, the maximum 1 hour in a 24-hour period. And again, it should be carefully monitored. They shouldn't be scrolling through YouTube and watching what they want.
I don't agree with that.
Sorry?
I don't agree with that.
With
No, there should be no screen time till 6 years of age.
yeah, I mean, this is just the general guidelines. Yeah.
I understand what they are saying up there, but yeah, you're right. Yeah, but because whenever we go to the classroom, in 10 minutes, I can tell which child has screen experience.
Absolutely, absolutely. Yeah, and I think I mentioned in the nutrition part about the higher incidence of ADHD. I think more than nutrition, it's probably the screen time that's contributing to that. In adults also, I think more, you know, because you have to have the constant interaction, the constant stimulation. So no, I agree with you. I mean, in an ideal world, you wouldn't have anything until they're school age and they have to have, you know, some amount, but this is just what they've put out there. So I will probably beat this to death, but a couple general rules are create a family media plan that everyone sticks to. So I realize it can be difficult if you have some younger kids and some older kids, but just say like, you know, no screens at the table, no screens right before bed, don't use the screen as a babysitter, etc. And don't use it to pacify. If your child is crying, don't throw, you know, a video in front of them. Actually pick them up and hug them would be a good thing. And then screen-free zone. So this is something we try to practice at home also. So our main hall, our living room, does not have a TV at all. We have one little area of our house where our TV is for watching movies. But if you keep it out of sight, out of mind, then it's less likely to be used. And this is I think less often in India, thankfully, but in the US, this is unfortunately very common. Do not put a TV in your children's room if at all possible. I mean, that's been going on for decades in the US and it still continues. And I think that leads to a lot of the disciplinary issues in the US, but that's a whole other issue. So no TV in the room for kids. So impact of excessive screen time impacts various parts of the child. So physical health, they're less active. So there's more incidence of obesity in kiddos that watch too much screen time, but it also affects their eyes. Usually, unfortunately, though, even if they don't have a genetic preponderance to wearing glasses, they end up wearing glasses, which is, again, why probably we see more kids with glasses these days. It can affect their neck muscles. They're looking down all the time, their posture, even their spine. It can cause scoliosis. So there's lots of negative impacts of, again, excessive screen time. Cognitive development, I mentioned, attention issues. So attention and attention ADHD, being able to, it's important for a child to be bored. Because then they are creative and they entertain themselves. It's okay if your kid says they're bored. Let them draw, let them do make-believe. Pediatricians love when kids are bored. If they're, oh, my kid's bored, great. Then they're going to invent their own games. So, you know, they can entertain themselves. If they're an only child, like before my little one was born, my older one had an imaginary friend. I'm sure he'd love me telling you this, but you know, he would sit and play with his imaginary friend for an hour. So let them have their own pretend play. That is the best thing for childhood development. Kiddos that have too much screen time tend to have more depression, more anxiety, more anger issues. They have less social interaction with their peers, with their family. When they go start school, they don't know how to interact with another kid. It's very sad. And that kind of falls into the next category as well. Also, sorry, one more thing. Sleep. So kids also can't sleep that have too much screen time, particularly if they're looking at a screen right before bed, but even screen time throughout the day can affect their sleep. Their mind is still moving and thinking, you know, brain is still running when they're trying to get to sleep about, you know, whatever the video that they watched during the day. So even if they sleep, they don't get good restorative sleep, and poor sleep is a huge factor in health issues from depression and anxiety to obesity to immunity. I could do a whole lecture on sleep, but not today. So, I mean, it's probably kind of obvious, but encouraging play dates, encouraging meeting family, encouraging actually running outside and using your body. They don't have to have a fancy sport. They can go for a walk, go to the pool, go to the playground. And I mean, that's so beneficial for every aspect of them. We talked about the screen time limits. For older kids, there's lots of apps now where you can have a little alarm that goes off or even turns off there. Like we have, what's it called? Custodio. So our older one is in 6th grade. So he has to be on screen time at school just because of his school. But when he does his homework, we make sure that he only uses it for his homework and he doesn't go into chatting with his friends. So he physically cannot use the screen anymore after an hour. So that's a good free app to use. And I'm sure there's many like that. And then setting a good example. So family game night, cooking together, taking walks together, social interaction with your family, but also teaching kids to learn new things and use their brain in different ways. So I don't know that you can actually read that, but there's a couple of things. So we talked about the family media plan. Make sure if and when they are doing screen time that you're actually watching what they're doing. Unfortunately, the internet can be a bad place for kids. So make sure there's parental controls or they're only limited to one app. The 20-20-20 rule is something that I think is a cool thing to remember. And this is not just for kids, for everyone. So for every 20 minutes of screen time you have, find an object that is at least 20 feet away and look at it for 20 seconds, at least, preferably longer. So that helps your eyes. It's almost like an eye exercise. So it prevents eye strain, prevents headaches, prevents you hopefully developing the need for glasses. Encourage alternative activities, make sure they're interacting with their friends, family, and peers. And then something that we all have to remind ourselves, be a role model. If you're sitting on your phone saying, you can't be on the screen, and then you go back to your phone, not ideal. So again, we're not perfect at our house, and I understand, but try to, for the most part, be a role model. So in general, trying to tie everything together. You can support your kiddos' health and development by balancing hopefully a mostly plant-based, whole food plant-based diet with mindful screen time, or when they're babies, no screen time at all. Make informed choices, set boundaries, and they will have a healthier future. Thank you.
Thank you.
And those are my two nuts.
Yes. Thank you.
I should say, I want to say something about Akash. So he had glasses.
Yes.
And we have been a lot more strict about his screen time and his diet because he used to cheat a lot with the dairy. He doesn't need them anymore. So I don't know if it's just coincidental, but
Hi, baby.
Yeah. You can take questions.
Any questions?
I have a small question.
No, Babu, no.
Can I go? Bina aunty, can I ask?
Please, yes, please.
Yeah, okay. So, one is the dairy bit that you said. Now, the options, I don't know how easy it is to find in our country, but I'll check that. And the second is when you put a lot of rules, don't kids, like I have older kids, 6-year-olds, don't they sort of rebel back if you put like a lot of rules and regulations?
Are you talking about screen time or about food or both?
No, both. I mean, they don't have too much screen time anyway, maybe once a week for half an hour, which I supervise. I mean,
Good.
I'm always with them, or sometimes a movie night, which could be once a month sorts.
Sure.
But I'm just generally saying that a lot of
Ashwini,
rules
इसको लेके
not
जाओ ना,
make
अभी
them
कॉल
rebel.
पे हूँ अभी.
Yeah, so I mean, you are correct to some extent. Yes, especially as they get older, kids will try to just prove their independence and say, I don't need your rules. But if you are providing a good example yourself, and if kids are smarter than we think, and if they in general follow the rules, they will realize that they feel better, they're doing better in school, they're sleeping better, just generally happier, then, I don't expect you to be super rigid. We're not super rigid at our house. We recognize, like, for example, when our kids go to parties, they still have dairy. I'm not going to yell at them for that. I understand that we all live in the, in the real world. So cheating with diet every once in a while is totally fine. When you're on vacation, cheating with diet or cheating with screen time when you're traveling, I'm also okay with that because, again, there aren't as many options on, a 10-hour plane ride. Of course, I can suggest some if you'd like, but having bendable rules, I think, is the best way to go about it. And like I said, don't underestimate how smart kids are. They will realize just that they feel better following these general principles. So you don't have to worry about being too stringent. And then, sorry, you were asking about non-dairy options in India. Was that your other question?
Yes.
Yeah. So we, you can always ask me. I think I have a whole list of everything. I'm always researching. I love cooking, so I'm always looking at the newest things available. So there's lots of different soy milk options. There is more and more almond milk. I have not yet seen a pea protein milk, although there is pea protein powder. Oat milk. Yeah, there's some millets milk. So there's one brand, what is it called? Pilk, Pilk, right? So they're a mixture of oats and millets milk, which I think is probably one of the healthiest ones because it has more fiber in it also and more vitamins because of the millets. That's available. And then plenty of tofu, which is not very expensive. Tofu is easy to substitute instead of paneer. Those are the main ones dairy wise. In the US, there's a pea protein milk that is probably the closest in nutrition to cow's milk. But in my opinion, soy is fine. The only thing with soy milk is you have to just look at how much sugar is being added because there are some soy milks that have a lot of sugar. So you just have to be careful about that.
Okay, that's an important piece of information, soy milk. I have one more question. So you spoke about imaginary friends, about your son, the younger one playing. So I have two 6-year-olds, and they both have these soft toys that they play with all day and sleep with them. How do I get them to be off the toys? At least while sleeping, I have to travel with the toys also everywhere.
Yeah. Coming from a 41-year-old.
Now they're old enough, right?
Sorry, say that again.
I'm saying they're old now. They're 6. I mean, all this while I was okay with it because it gives them some sense of security. But now I don't know if is that to be still allowed or I mean I've had this discussion with Beena auntie also, but
so I'm a bit of a softie with this sort of thing. Maybe I'm the wrong person to ask. I'm fine with it. I would say, and this has happened with our older one, as they get older and there's more peer pressure, that will slowly, bringing things with them will slowly decrease. But in terms of psychological things now, it's fine. I mean, it's a bit of a pain to carry things with you. So maybe you can say, choose one soft toy for trips or for overnights, but at home you can play with them. I think it's great that they're playing with them during the day, especially if they're doing it for hours at a time. I'm always impressed by a child that can entertain themselves or entertain their friends without adults having to entertain them. If they can, have their imaginary friend or their toys. I think that's a good thing. That's great for creativity and for, exercising their brain. But don't worry about, at age 6, I wouldn't worry too much about it. I think it will slowly peter out as they get older in school.
Okay, thanks.
Yes, milks, the ready-made milks, aren't they not highly processed?
They are. And so that's also, if you can make it at home, great. I realize so it's actually not that difficult. Dr. Rupa, who is one of our plant-based doctor friends, there's a soup maker on Amazon that's 6,000 rupees. And you can make any plant-based milk from that. You just throw everything in and you have it. Yeah. Does it work? Works? Yeah. So that is the best thing to do is make your own at home. There have been studies saying cow's milk versus the more processed plant-based milk. It's still better to have the more processed plant-based milk, which I guess So if you have to choose, I would rather you have that. But if you can make it yourself at home, that's better. There are some of the brands that are less have less preservatives and are less processed. Of course, I can't think of it right now, but if you just look at the number of ingredients and the amount of sugar, and then unfortunately, some of them I think have like palm oil as a emulsifier, which is not great. But it's very easy to make almond milk and soy milk at home. Yeah.
Soy milk I have not tried. And so I don't know to get non-GMO.
Yeah.
Soy is
Yeah, that's also,
organic non-GMO.
I think it's easier to get here than in other parts. The soy part is easier here as opposed to more in the West. But yeah, that's something to make sure of
You
too.
get this question saying that, oh, you know, it's non-GMO and pesticides, blah, blah, blah. I tell them, start there at least, because I mean, I know a lot of you guys are vegan or plant-based, but people who are not, they get stuck with that and they are like, oh my God, why should I go to this pesticide-laden thing when I can just milk? And I'm like, for heaven's sake, stop that, because it's much.
Yeah, if you, Dr. Rupa has a great, she in her book, and I think you've talked about it too. If you look at a glass of milk, what is the percentage that's pesticides? It's I mean, just milk.
Plus, it's just.
Yeah, because if the cow is eating the grass that is full of pesticides and then, you know, antibiotics all the time and inflammatory cells, hormones. So, yes, the ultra processed, plant-based milks are not great. So that's another reason why, like, you don't need to have the milk, any milk at all, any white liquid at all. You can just get everything from, you know, from fruits, vegetables, tofu, etc.
How about oat milk? I'm sorry, go on. How about oat milk?
So oat milk is, I think, when you're getting someone to transition from cow's milk, I think it's a great transition because I think the flavor, the texture and the flavor is very similar to cow and buffalo milk. It's very creamy. I actually can't really have oat milk anymore. It reminds me too much of milk. So I prefer almond milk, but oat milk's fine. I mean, oats themselves are great. They are known to lower cholesterol. I think the only issue with oat milk is actually oat milk. Yeah, it has a little, not as much, gluten. Yeah, potentially a little bit of gluten for people that can't have, but most time, you know, yeah, it's just a tiny bit. Also, it might have sugar, and it might have oil for an emulsifier, but I think after soy, oat is probably the next best. Almond, I love the flavor, but almond milk's mostly water. So it's not, nutritionally is not great, but I still like it. So.
So how does the harmfulness of milk translate to the milk products we commonly use in Indian diets? Ghee, dahi, and cheese.
Yes.
Yeah.
So cheese is easy to avoid typically, but
Ghee is,
and dahi I want my kid to have because I don't see any other probiotic source in my usual acceptable diet.
so that's a great question. We get that a lot. So cheese, yes, just try and avoid it. There are some vegan cheeses out there, which I think are pretty gross. So we generally don't eat them. I make my own vegan cheese, and it's pretty easy to make out of cashews. Cashew is a great base for cheese, and he loves my vegan cheese. And we had some friends over the other day, his two best friends who are five-year-old twins, and they inhaled the vegan cheese, and they're girls that like regular cheese. So don't be, I'm going off topic here, but don't dismiss your kids' taste buds. They're usually a lot more mature than you think they are. So they'll eat anyway. So cheese, fine.
And yogurt and ghee.
Yeah, I'll talk about that. So yogurt, I think of all the dairy products is the least harmful, but still we would want you to avoid it because it has good probiotics. That being said, you can get probiotics from fruits and vegetables. There's something called prebiotics, which are a lot of the grains, a lot of the starch, the good starches are prebiotics, which are converted into probiotics by your body. Fermented foods, which there's so many fermented foods. Yeah, dosa, idli, dokla, sorry. You can make it without sugar. I don't like sugar in my dokla. But yeah, idli dosa, very easy. And that has probably the same amount of probiotics as yogurt. It's I'll get to that too. What other fermented foods? Kimchi, if you eat Korean food, is a great source of for probiotics. And supplemental probiotics. Yep, you can do that too. They have it. That same melt away brand, there's a probiotic. Melts. It's called Melt, yes.
Okay.
But there's
Kind of Amazon.
Amazon, yeah.
So there's a brand for well-being also.
Yeah, that's the one I was talking about. Yeah, so that's what we use. But you can even there's other ones too. You can find them pretty easily. Kid probiotics, and there's vegan yogurt available. So we at our house we use peanut curd, which I think is a great, not minimally processed. And in fact, it's a traditional Marathi dish, I believe. Like they've been making it forever.
What is it called in Marathi?
Do you know?
How you make it at home?
Yeah, you can Google a recipe to make it at home. But it's delicious. It has similar consistency to like the desi curd that you make at home. Like there's thick parts and watery parts. So when we make biryani or anything that you normally curd with, we use that, and it's not expensive. It's 99 rupees for 500 grams, maybe.
Well, you're buying.
Yeah.
It's available. There's a brand called One Good.
It's Nature's Basket.
Yeah, Nature's Basket, Big Basket.
We make it at home also. I make it at home, but I make it at home in an emergency.
Yeah, it's
Safely
there.
made. And 1 teaspoon of rice flour, how we make custard, if you add by boiling the peanut milk, then it sets it sets beautifully.
Yeah, and the kids
And for
like
dahi
it.
vadas and things
Yeah,
like
it's
that.
very good for that.
And vada also we make it in that paniyaram mold, so there's no oil. Also now there are so many people that you can, there are these subscriptions, so even your plant-based, all your milks and dahis,
Yeah.
people they just deliver
Yeah.
to you.
So that's a good option.
I've been ordering
Yeah.
somewhere from
You don't
somewhere,
wanna
very
get
good,
those
non-GM, organic.
Yeah, you're right. That's a great option for less processed and less
Yes.
preservatives. There's lots of, I can think of 3-4 Instagram people that sell their homemade almond milk and soy milk and everything. So that's a good option, although I guess more expensive. But
We had accent Srikhand and stuff.
yeah, from
there's
Pune, there is
There's
some.
a movie that Dr. Rupa actually is the producer of. We are also in it, but it's about like there will be 5 episodes, I believe. And we went for the first premiere,
Okay.
and all the stuff that was served was homemade, like vegan stuff, and
The Shrikand was amazing.
Amazing, absolutely.
Wow,
Yeah.
very
Yeah.
So there's more and more options for
What's the
finding.
Oh, movie's called Doctor in Me. It's going
Doctor in me.
Yeah.
I can send you
Okay.
it's being released on YouTube, I think, right?
YouTube, and there is a website they started creating, and we are curating a list of scientific journal references to everything that the doctors are talking about. There are like 17 of us there talking about why we should be moving towards a plant-based diet.
Okay, so ghee, which is
Ghee.
a big thing here, and I understand. So you don't, so ghee, unfortunately, it's very, very highly processed because you would think it's not just because it's ghee and it's in everything and it's so delicious. I won't say it's not delicious. I love ghee, but it's heated, ultra processed, filtered. So it's a very highly processed food, and it's concentrated. All of the bad things in cow's milk basically gets concentrated into the ghee. So that doesn't get filtered out. It's all like I guess the proteins or whatever get filtered out, and you just get the ghee left. So ideally, and I understand like in-laws and grandparents saying, oh my God, you can't not give we get that all the time with them. But if you can reduce it, that would be good. There are vegan ghees available. They're not that great. What we do instead of ghees, we use coconut oil. And that should have the same benefits that ghee does, to be honest, if not more, because it's not giving you all the hormones and the antibiotics and everything that come with eating ghee. So that's what we use. Coconut oil or olive oil. Olive oil is also has kind of a more umami taste, I think, than coconut oil. So we use either one of those for, yeah.
But what if we avoid only?
Sorry, say that again.
Like if we avoid ghee.
Yes.
Oil, because
Yeah,
I don't give that
you
much.
don't have to. I'm sorry. If you're looking for like a straight alternative, then that's what you could do, but you do not need, you get enough oils from foods, from especially nuts and seeds. Yeah.
So I'm not giving milk also to my 9-month right now. Not even giving any milk. But at night, I prefer giving oat milk, which I make. So, but if I can avoid that also if needed.
I would give boy or girl.
Why?
But I would give him soy formula if you can until
That's
12
what I
months.
wrote. Sorry.
Yeah, I mean, it's probably definitely not before 6 months. I wouldn't do that. The problem is they can't baby kidneys can't handle water, basically. So if you give them almond milk or oat milk that has a fairly high water content, then they can have really low sodium and they can have seizures, and it's very dangerous. 9 months, it's less risky. Is he eating other like table foods and everything else? Yeah. It should be, he's probably fine, but ideally we like formula or breast milk to continue until 12 months. So if I would say soy, if you could probably do soy milk at this point instead of, but soy formula would be a little more nutrient rich.
But if he's not asking for any milk, then like during the entire day he's eating so many other things. At sleep he requires maybe like
Something for
3-4
comfort.
hours. Yeah, just for comfort.
Try to switch that to soy, because that's a little more, because oat is good for an older kid, but for someone that little, I'd prefer a little more protein, a little more calcium. It's hard, when we train in medical school, we get no nutrition support or lectures, maybe one. So all of this that I learned was learned after I graduated. I was lucky enough my colleague, when I first came out of medical school, she was a nutritionist before she was a doctor. So she taught me a lot too, but most doctors get no nutrition education. So we follow, like, you have to have formula or breast milk until 12 months. So it's hard for me to tell you no, although to be honest, it's probably fine. He's growing fine, developing fine. It's probably fine. But the only difference I would say is try to do soy instead of oat, because it's a little better.
And can you talk a little bit about MSG and the effect it has on kids and diets? Because I think it makes its way into a lot of things without us knowing it. And also there is this understanding that MSG is a complete no-no, but so many countries in the West use it as a staple.
Yep.
And I'm told that our bodies manufacture it as well and we need it. So I'm a little confused on.
Yeah, there's lots of conflicting. So MSG is fine. That's the bottom line.
For kids as well.
For kids as well. Keeping it, basically it's used as an emulsifier, isn't it? No, sorry, as
it's usually used in Asian cooking to keep the greens.
That's preservative, stabilizer, yeah, not emulsifier, it's the wrong word. But it's
not a flavor enhancer.
I mean, it enhances umami, right? So when you eat that, you get this thing and you don't know what it is, but it tastes good.
So it's safe. There was a lot of bad press around MSG in the 80s or something. Unless you have a known allergy to MSG, or if MSG is a migraine trigger, which it is for some people, and this would be more for adults, MSG is fine. Because exactly what you said, they use it everywhere in the East, right? And there aren't any of the associated issues. I think there was concern about, what was the concern with MSG? That it was just like.
It was just bad press because I think the Chinese restaurants and all, I'm talking about the 80s in the US.
Right.
Chinese restaurants and all are doing very well. Oh. And no, this is the truth. Italian restaurants are not doing well. So they just spread this thing. And there's absolutely no scientific evidence, not a single scientific paper have you come across that says MSG has bad effects. Now, there are some issues, like you said.
Like for individuals.
Yeah, predilection for getting a headache because of having MSG, then you have some kind of an allergy going on. Mm-hmm. So,
and it might manifest in other ways, but usually it's headache. Yeah. That's the most common, but only those people. We cook a lot of Chinese stir fries. So.
And avocado, you can boil it. I mean, you can heat it or just
you can heat it. I think it has less. There's some breakdown of some of the nutrients when you heat it, but you can heat it. Cold press oils are ideal, in a perfect world. But you can heat it, but if you have to heat an oil, a non-extra virgin olive oil is probably your best bet. Yeah. I mean, extra virgin is fine too. It's just more expensive. So you can buy extra virgin. It's just. So that's what we use at home. We have olive oil, sesame oil, mustard oil. Yes, and groundnut oil. Those are what we have. Those are the oils that we use. We actually don't even have avocado oil, not for any particular reason, but that's a very good one to use. Thank you so
Thank you very
much.
much.
Thank you.
Thank you.
Thank you.
It's really lovely.